Good morning. Today we are going to discuss about the front of leg and dorsum of foot. The leg is that part of the lower limb which lies between the knee joint and the ankle joint. That is between the knee and the ankle is called leg. As far as the bony framework of the leg is concerned, it has two bones, tibia or medial bone and fibula or lateral bone, which are arranged parallel to each other, like in case of forearm, radius and ulna. Forearm radius is lateral, ulna is medial. In case of leg, tibia is medial bone and fibula is lateral bone. This is the anterior view of right tibia. This anterior view of right fibula. And this tibia, the upper end is condyle, the two condyles, a medial condyle and a lateral condyle. Then there is a shaft, and lower down there is a lower end of tibia with a projection coming medially, which we call a medial malleolus. This medial malleolus is both subcutaneous and palpable. You can complete this medial malleolus in your own foot. As far as surfaces and borders of this bone are concerned, there is an anterior border of the tibia, which is called subcutaneous, which you can palpate the sharp anterior border of tibia in your own leg. And then there is a medial surface of tibia, which is subcutaneous. This also is quite palpable. You can palpate the medial surface of tibia below the knee in your own leg. This is also called the shin of tibia. Then, apart from this medial surface which lies between the anterior border and the medial border, there is an interosseous border. Interosseous border is lateral border of tibia, where the interosseous membrane attaches the two bones, that is tibia and fibula. Then, between this interosseous border and this medial border, there is this posterior surface of tibia. This is the posterior surface of tibia. As far as fibula is concerned, it has an upper end, which we call the head, which articulates with the tibia, and a shaft. Again, this is a long bone. And at the lower end is the malleolus, which is a lateral malleolus, which you can see in your own foot also. The lateral projection at the junction of the foot and the leg is this lateral malleolus. As far as borders of fibula are concerned, again it has an anterior border, a border between the anterior border and the medial border, that is the interosseous border. Medial border of fibula is the interosseous border, which is giving attachment to the interosseous membrane. Then there is a posterior border and a posterior surface of fibula. If we see cross section of these two bones, this is tibia and fibula, both are triangular. There is a medullary cavity. This is the anterior border of the tibia. This is the lateral border of the tibia or the interosseous border. So, in between this anterior border and the lateral border is this lateral surface of tibia. Between the anterior border and the medial border is this medial surface of tibia, which is subcutaneous. And then between the interosseous border and the medial border is the posterior surface of tibia. As far as fibula is concerned, again it has an anterior border, a posterior border, and the interosseous border. So, between this interosseous border and the anterior border is this surface, which is the anterior surface or the medial surface of tibia. Between the anterior and the posterior borders is the lateral surface of tibia. And between this posterior border and the interosseous border is the posterior surface of tibia. So, three surfaces of tibia and three surfaces of fibula and three borders of fibula, and similarly three borders and three surfaces of tibia. So, tibia has a medial surface, a lateral surface, and a posterior surface. Fibula has a lateral surface, a posterior surface, and a medial or the anterior surface of fibula. Skin of the front of the leg is supplied by two nerves, two cutaneous nerves. Along the medial half, that is from the anterior border of the tibia, which we also call the shin, to lower down towards the medial border of the foot, middle of the foot, this region is supplied by saphenous nerve, which is a branch of femoral nerve. The lateral half of the front of the leg is supplied by, on the upper 1/3 to half, by the lateral cutaneous nerve of calf, which is a branch from the common peroneal nerve. And the lower half of the leg laterally is supplied by superficial peroneal nerve, which again is a branch of common peroneal. As far as the dorsum of the foot is concerned, the lateral border of the foot is supplied by the sural nerve, and a cleft, barring the cleft between the great toe and the next toe, that is the second toe, is supplied by the peroneal nerve, rest all by the superficial peroneal nerve. If you look at these tibia and fibula, this is the anterior view of tibia and fibula, two leg bones. This is the tibial tuberosity, which is quite palpable. These are the two condyles of tibia, the lateral condyle, the medial condyle. This is the medial malleolus. Similarly, fibula, the height of fibula is constriction. Just below the height is the neck of fibula, and lower down the lateral malleolus. These are the anterior border of tibia, anterior border of fibula, and this is the lateral surface of fibula. Behind are the posterior surfaces. These are the interosseous border of tibia, interosseous border of fibula. Interosseous border of tibia is lateral, and interosseous border of fibula is medial. So, deep fascia of the leg is surrounding this lysosomes all around these leg, so that it's covering the muscles. Now, this deep fascia, which is surrounding the leg all around, deep to the superficial fascia, is sending in certain septa. These intermuscular septa are dividing this leg into various compartments. And these compartments are the anterior compartment or the extensor compartment. The posterior compartment of the leg is the flexor compartment, where you can palpate your calf muscles, and the lateral or the fibular compartment. This is divided into these compartments by the passage of this interosseous membrane, which is connecting the two corresponding borders of tibia and fibula, that is lateral border of tibia and the medial border of fascia surrounding the leg is directly attached to the periosteum of the tibia on the anterior border, medial border, and medial surface, which you can calculate is subcutaneous. There are no muscles present out there, but for just uppermost end, few muscles coming from the head bone. Then the deep fascia surrounds all around. Then this deep fascia is attached to the fibula by two intermuscular septum, and anterior and a posterior. So, anterior compartment of leg is bounded between the tibia and fibula and behind by the sebaceous membrane and laterally by the anterior intermuscular septum, which is attaching to the anterior border of the fibula. The lateral compartment of the leg is between the two intermuscular septa, dividing the leg into three compartments, that is the anterior and the posterior intermuscular septa attached to anterior and the posterior border of fibula, and this is called the lateral compartment. The posterior step is called the posterior compartment of leg, that is between the attachment of the deep fascia to the lateral border of the tibia, all around the medial surface, anterior border. This is the medial compartment of the leg. That is beyond this medial compartment. Over here is again the attachment of the fascia to the medial border of the tibia, and then to the till the posterior intermuscular septum. So this is the posterior compartment. Today we are going to discuss about the anterior compartment of the leg, that is deep fascia in the front and sebaceous membrane behind, and then the anterior intermuscular septum. This anterior compartment of the leg has four muscles: tibialis anterior, extensor hallucis longus, name itself suggests. This is going to be extensor of the hallux or the great toe. Extensor digitorum longus, which is going to be extensor of the rest of the four toes, lateral four toes, and peroneus tertius or the fibularis tertius. All these muscles are present in the anterior compartment of the leg. So, they are going to dorsiflex the foot at the ankle joint. Dorsiflexion is when you take the foot towards the leg. Plantar flexion is when you try to take the foot on the opposite side. Then they help in extending the toes, the extensor hallucis longus and extensor digitorum longus correspondingly. They will extend the great toe and the rest of the little four toes. And invert, the inversion is when the medial border of the foot is raised and sole faces medial. Reversion is opposite. Peroneus tertius can cause reversion of the foot, but rest all muscles will cause the inversion of it. Nerve supply of all these four muscles is deep peroneal nerve or the deep fibular nerve, a branch of common peroneal nerve. So let's see the muscles of the anterior compartment of leg, that is tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. The tibialis anterior muscle arises from the lateral surface of tibia, that is the surface between the interosseous border and the anterior border, the surface of tibia, and also from the under surface of the lateral condyle of tibia. This is tibialis anterior arising from tibia lateral surface. This medial surface of tibia you can see is subcutaneous. So this tibialis anterior goes down towards the foot under the two extensor retinacula present, the superior and the inferior extensor retinacula. The superior extensor retinacula passing between the two borders, anterior borders of tibia and fibula, thereby helping retaining the tendons and other vessels, nerves passing from the leg to the foot. This goes down and attaches to the base of first metatarsal bone and to another small tarsal bone present over here, the medial cuneiform bone. Its medial surface. There are three cuneiforms present in case of foot: medial, intermediate, and lateral. So great toe is towards the medial side. So to the medial surface of the medial cuneiform bone and the base of the first metatarsal bone. Tibialis anterior. So if you see, it's ending out here. So it's not going to extend the toes. This is the tendon of tibialis anterior passing deep to the extensor retinaculum superior as well as inferior, surrounded by the synovial sheath, definitely to prevent the friction, and goes and attaches to the base of the first metatarsal and the medial surface of the medial cuneiform bone. Nerve supply of this tibialis anterior is a deep peroneal nerve or a deep fibular nerve. Because of its attachment out here, it's crossing the ankle joint from the front, so it's helping in dorsiflexion of the foot at ankle joint. That is, when you try to take the dorsum of the foot towards the leg, and inversion of the foot when you raise the medial border of the foot and it faces medial. Also, you must have seen that the foot is not a flat single structure. You must have seen your wet footprint is arched. There's a medial longitudinal arch and a lateral one. So this muscle is medially attaching out here, so it helps in supporting the medial longitudinal arch of foot also. This is showing the inward movement of the sole when the medial border of the foot is raised and the sole faces medially. This is inversion of the foot. So tibialis anterior causes the dorsiflexion of the foot, inversion of the foot, and it helps in maintaining the medial longitudinal arch. Extensor hallucis longus, the second muscle, name itself suggests it's going to be extensor of the hallux or the great toe. This muscle arises from the middle half of the medial surface of fibula and the adjacent interosseous membrane. This is the attachment of extensor hallucis longus. This muscle, after arising from the fibula and the adjacent interosseous membrane, that is middle half of fibula, again this passes deep to both extensor retinacula and goes and attaches at the dorsal surface of the base of the distal phalanx of the great toe. This is also supplied by deep peroneal nerve, and because of its attachment to the distal phalanx of the great toe, it helps in extension of the great toe and dorsiflexion of the foot. Extension Your dorsiflexion is similarly, you try to pull the foot towards the leg, and extension of the great toe, again you move it upwards towards the dorsum, that is extension. So by virtue of its attachment, because of its contraction, it helps in dorsiflexion at the ankle joint and extension of the great toe. Again, this extensor hallucis longus is passing deep to the two retinaculum superior and inferior, again covered with synovial sheath and to prevent friction, and goes and attaches at the base of the distal phalanx of the great toe. The third muscle present on the front of the leg or anterior compartment of the leg is extensor digitorum longus. Name itself suggests this is going to be extensor of the lateral four toes. This muscle arises from the proximal one half of the medial surface of the fibula and to some extent from the adjacent region of the lateral condyle of tibia. This goes again, this muscle, that is extensor digitorum longus, traverses down under the two extensor retinacula and divides into four separate tendons or four lateral toes. So via dorsal digital extension of the toes, lateral four toes, it goes and attaches onto the basis of the distal phalanges and the middle phalanges. There are three phalanges present in the lateral four toes and two only in the great toe, like in case of hand. Thumb has only two phalanges and rest of the four medial fingers have three phalanges. Very similarly, the lateral four toes have three phalanges and the great toe have two phalanges. So, this extensor digitorum longus goes and attaches onto the middle, basis of the middle and the distal phalanges via the dorsal digital extension. Again, it helps since it's crossing the ankle joint from front, so it helps in dorsiflexion of the foot and extension of the lateral four toes. Nerve supply, again, the deep peroneal nerve or the deep fibular nerve, a branch of common peroneal nerve. Extensor digitorum longus, when it passes deep to the superior and inferior extensor retinacula, it's covered, all four tendons are covered in a common synovial sheath, and then after reaching the dorsum of the foot, they divide into four separate tendons for four lateral four toes. Now the fourth muscle is peroneus tertius or the fibularis tertius. This arises from the distalmost part of the medial surface of fibula, and this goes and attaches to the base of the fifth metatarsal bone. This is also supplied by the deep peroneal nerve and also similarly helps in dorsiflexion of the foot, but since it's going towards the fifth metatarsal, that is towards the lateral border of the foot, so it helps in eversion of the foot. Eversion is when you raise the lateral border of the foot and the sole faces laterally. So that is the only difference. Otherwise, this is also helping in the dorsiflexion of the foot. This is the place where base of the fifth metatarsal bone is there, where the fibularis tertius is attaching. It is arising from the medial surface, lower 1/4 only of the fibula, small muscle, and goes and attaches onto the base of fifth metatarsal bone. This is eversion of the foot being caused by peroneus tertius, that is, lateral border of the foot is raised and sole facing laterally. So let's see all these attachments once again on the bones. This anterior view of tibia and fibula. So this is the anterior border of tibia, this is the anterior border of fibula. This is the lateral surface of tibia, this is the medial surface of fibula. So tibialis anterior arises from tibia from the lateral surface and undersurface of lateral condyle. The extensor digitorum longus, extensor hallucis longus, and peroneus tertius, they all arise from the medial surface of fibula and one line. Extensor digitorum longus, a big muscle from the upper 1/4 of the medial surface of fibula and the adjacent lateral condyle. Extensor hallucis longus from the middle half of the medial surface of fibula and peroneus tertius from the lower 1/4 of fibula. All these three muscles, extensor digitorum longus, extensor hallucis longus, and peroneus tertius, are arising from medial surface of fibula. Tibialis anterior from lateral surface. The peroneus tertius to the fifth metatarsal bone, extensor hallucis longus to the base of the distal phalanx of the great toe, extensor digitorum longus to the basis of the middle and the distal phalanges of the lateral four toes. The tibialis anterior to the medial cuneiform and base of the base of the first metatarsal bone. All these four muscles are supplied by deep peroneal nerve. All are causing dorsiflexion of the foot. All are helping in inversion of the foot. But for the peroneus tertius, which helps in eversion. An extensor hallucis longus, extension of the great toe, and extensor digitorum longus, extension of the lateral four toes. All these supplied by deep peroneal nerve, which is a branch of common peroneal nerve, which is a branch of sciatic nerve. The common peroneal nerve at the level of neck of fibula, the constriction just below the head, divides into two, the superficial peroneal and the deep peroneal nerve. Superficial peroneal nerve goes laterally, supplies the lateral compartment of leg. Deep peroneal nerve comes anteriorly and this supplies the anterior compartment of the leg. All muscles of anterior compartment and two muscles even of dorsum of foot, which we will discuss now, are supplied by deep peroneal nerve or the deep fibular nerve. What are the branches of this deep peroneal nerve? It gives a recurrent branch backwards. Then it gives muscular branches to all the muscles of the anterior compartment of leg. Then it gives articular branches to the various joints present in relation to this. Then it gives cutaneous branch to the cleft between the great toe and the next toe. That is the second toe. So the cleft between this region is supplied by deep peroneal nerve. This also supplies two short muscles on the dorsum of the foot, the extensor digitorum brevis and extensor hallucis brevis, which we will discuss just now. When it goes to the foot, this deep peroneal nerve ultimately divides into two branches, a lateral branch and a medial branch. And through these lateral and medial branches, this supplies the tarsal joints and the first and the second dorsal interossei muscles. The main action of these muscles of the anterior compartment of leg since they are crossing the ankle joint from anterior step, is dorsiflexion. That is foot going towards the leg. And this action is all the time you are using while walking. So whenever the deep peroneal nerve gets damaged, may we say fracture of neck of fibula or otherwise, so all these muscles will get paralyzed. So unopposed action on the opposite group of muscles, that is plantar flexors, will lead to foot drop. The person will have difficulty in walking and inability to dorsiflex the foot. Normally, dorsiflexion of the foot, that is, you can take the foot towards the leg, whatever extent, but if that is not possible, unopposed action of the plantar flexors will lead to foot drop, and that is due to the injury to the deep peroneal nerve. The artery which is present in the front of the leg is anterior tibial artery. Anterior and the posterior tibial arteries are branches of, terminal branches of popliteal artery. So this anterior tibial artery through the interosseous membrane comes to the anterior compartment of the leg and supplies all these muscles in this region. Apart from that, this tibial artery gives anterior and posterior tibial recurrent branches. Then in the foot, it gives a branch towards the lateral malleolus, which we call the lateral malleolar branch, and towards the medial malleolus as medial malleolar branch. So branches of this anterior tibial artery, which is given posteriorly in the popliteal fossa by the popliteal artery, passes through a gap above the interosseous membrane, comes in the anterior compartment of the leg, lies on the interosseous membrane, and gives muscular branches to all the muscles present in this region. Then it gives recurrent branches towards the tibia anteriorly as well as posteriorly, anterior and posterior recurrent branches. Then it gives medial malleolar artery and lateral malleolar arteries towards the medial and the lateral malleolar branches. Beyond the ankle joint, this artery continues towards the foot, towards the dorsum of the foot, and in the dorsum of the foot, this artery, which is continuation of anterior tibial artery beyond this ankle joint, is called the dorsalis pedis artery. This dorsalis pedis artery beyond the ankle joint, after it has anterior tibial artery has given the malleolar branches, this gives the branches to the dorsum of the foot, an arcuate artery which goes along like an dorsal arch around the dorsum of the foot, that gives the first dorsal metatarsal artery, and to the arcuate artery, the common metatarsal artery which is supplying the dorsum of the foot. The importance of this dorsalis pedis artery is its pulsation. It's called subcutaneous, and this pulse is evaluated to evaluate the peripheral vascular system. That is dorsalis pedis pulse. This can be palpated on the dorsum of the foot with foot slightly dorsiflex. You can dorsiflex your own foot at the moment and try to palpate for dorsalis pedis artery. It's very easy to palpate with foot slightly dorsiflexed only. The artery is quite subcutaneous and it passes along a line from the extensor retinaculum, that is, from the lower of tibia fibula to a point just lateral to tendon of extensor hallucis longus. If you try to extend your great toe, you can very well see the tendon of extensor hallucis longus. So just lateral to that, where the bony eminences of the dorsum of the foot are there, Just lateral to the tendon of extensor hallucis longus, one can palpate dorsalis pedis artery. In case the pulse is diminished or the dorsalis pedis pulse is absent, this suggests that there is vascular insufficiency resulting from some arterial disease, some peripheral vascular disease, more common in case of smokers. So, peripheral vascular pulse can be palpated, especially in dorsalis pedis artery, because it's quite subcutaneous. Cutaneous supply of the dorsum of the foot is continuation from the front of the leg only. More or less, whole area of the foot dorsum is supplied by superficial peroneal nerve. But for along the lateral border till the lateral half of the little toe by the sural nerve, an interdigital cleft between the great toe and the first lateral toe is the deep peroneal or the deep fibular nerve. Rest of the dorsum of the foot is supplied by superficial peroneal nerve. The saphenous nerve coming till little anterior or little distal to the medial malleolus. As far as the venous drainage of the dorsum of the foot and the leg is concerned, this is via this dorsal venous arch which is forming near the middle of the shaft of the metatarsal bones via joining of small intermetatarsal veins. This dorsal venous arch goes laterally, joins with the lateral malleolar lateral marginal vein and forms the great saphenous medial or in front of medial malleolus. This is the region where commonly even venous cut down is done. This great saphenous vein which is formed out here goes along the medial surface of tibia, then in the middle of the leg goes posteriorly, and ultimately we have seen its drainage into the femoral vein in the region of femoral front. On the lateral side, this lateral end of dorsal venous arch joins with the lateral marginal vein to form small saphenous vein behind the lateral malleolus. This is behind the lateral malleolus. Great saphenous vein is anterior to the medial malleolus. This goes posteriorly in the back of the leg and ultimately drains into the popliteal vein, small saphenous vein. As far as the deep fascia of the foot is concerned, it is thin on the dorsal aspect of the foot, where it becomes continuous proximally with the thickening of the deep fascia present, that is the inferior extensor retinacula. We have seen two extensor retinacula present along the lower border of the tibia and fibula and on the dorsum of the foot. The superior extensor retinacula is a strong band or thickening of deep fascia passing from lower end of fibula to lower end of tibia, just proximal to the malleoli, that is medial malleolus and lateral malleolus. The inferior extensor retinaculum is a Y-shaped band of deep fascia which is laterally attached to the anterosuperior surface of the heel bone. You can palpate your heel. So heel bone, anterosuperior surface laterally. It forms a loop around the lateral tendons present in this region, that is peroneus tertius and extensor digitorum longus. This is the superior extensor retinaculum attaching just above the malleoli to the tibia and fibula. This is the inferior extensor retinaculum with its stem attaching to this region on the anterosuperior surface of the calcaneum, and the tendons of the front of the leg pass to the foot deep to these, separated by the synovial membrane. The sequence by which they pass, that is medial to lateral, these tendons are tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. As far as the artery and nerve of this compartment are concerned, that is anterior tibial artery and deep peroneal nerve, they lie between the tendon of tibialis anterior and extensor hallucis longus. So the sequence between tibialis anterior, anterior tibial artery, deep peroneal nerve, then the tibialis anterior, extensor hallucis longus, then the anterior tibial artery, deep peroneal nerve, extensor digitorum longus, and peroneus tertius. So these two vessels, that is deep peroneal nerve and the anterior tibial artery, which were traversing deep to these extensor retinaculum, are ultimately lying between the extensor tendons of the great toe and digits, that is extensor hallucis longus and extensor digitorum longus. In fact, there were two more muscles present in the dorsum of the foot, which are being supplied by deep peroneal nerve. These are short muscles, extensor digitorum brevis and extensor hallucis brevis, present on the dorsum of the foot. Of course, they are helping. Extensor digitorum brevis helping the extensor digitorum longus, and extensor hallucis brevis helping the extensor hallucis longus. Both these muscles arises, this is the dorsum articulated foot on the dorsal surface. There is a calcaneum, there is a talus, there is a cuboid, the three cuneiforms medial, intermediate, lateral, the five metatarsals medial, first, second, third, fourth, and the pelvis. So both these muscles, they arise from this anterosuperior surface of the calcaneum over here. From the anterosseous talocalcaneal ligament, there is talus bone and calcaneum, talus present above the calcaneum over this region, and from the inferior extensor retinaculum. So the extensor digitorum brevis goes and attaches to the long tendons of the lateral four toes, that is extensor digitorum longus. As far as hallucis brevis, it goes and attaches to the dorsal aspect of the base of the proximal phalanx of the great toe. Both are supplied by deep fibular nerve. Extensor digitorum brevis helps the extensor digitorum longus in extending the lateral four toes at a metatarsophalangeal and interphalangeal. The hallucis brevis, extensor hallucis brevis, helps extensor hallucis longus in extending the great toe. The extensor hallucis brevis is helping the extensor hallucis longus in extending the great toe at the metatarsophalangeal joint, because it's attaching over here at the base of the proximal phalanx. Both are supplied by deep fibular nerve. That's all for today. Any questions you can ask?